Welcome back. In this video, we'll talk about the symptoms and treatment for food poisoning. Food poisoning occurs due to eating contaminated or spoiled food. And it's very common. In every 7 patients, one will have food poisoning, which makes more than 128,000 cases every year in the United States. Symptoms vary greatly between patients and between the sources of infection, but mainly they include abdominal cramps, diarrhea, nausea and vomiting, loss of appetite, sometimes mild fever, weakness, and headache. These are the most common symptoms and they are the mild ones. There are some more severe life-threatening symptoms, and these include diarrhea that would last more than 3 days, very high fever, difficulty seeing or speaking, severe dryness, and this translates into dry mouth, and no urination. Also, bloody urine. Most cases of food poisoning resolve without any treatment in about 1 week, but they can range depending on the source of infection, anywhere from 30 minutes all the way to 2 months. Simply stay hydrated, drink a lot of water, and focus on the fluids that would replenish your electrolytes, and this include fruity juices and coconut water. Avoid coffee and caffeine because this irritates the stomach and causes further dehydration. Take over-the-counter medications such as loperamide or briptopismol, and these both can help suppress the nausea and vomiting, and they also manage the diarrhea somehow. But you should consider talking to your doctor before taking these medications, as sometimes you need to have diarrhea to expel the toxin out of the body, but that depends on the source of infection. And finally, before I go, these are the best food that you should consider and avoid during food poisoning. If this video helped you in any way, please consider supporting me on Patreon, as it's much needed. Thank you so much for watching, and I'll see you guys later.